Hi, my name is Julie, and I'm a nurse practitioner here at Winter Park and Claremont, and I'm going to show you how we run through a PRP procedure with Dr. Taylor here. He's one of our chiropractors, and so he's been having some soft tissue injury in his shoulder, and he's come in for a PRP injection. So we're going to get the Platelet Rich Plasma and shoot it into his subacromial space in his left or right shoulder? Right shoulder. Okay, so you'll first start with the kit, and then you'll have some other equipment like a tourniquet here, and we will prep the site just like if you were doing any type of blood draw. So you're gonna need your gloves, some alcohol, a tourniquet, Band-Aid, a couple of cotton balls. I'm gonna open up this kit here. We want to make sure the patients are not on any type of steroids, on any type of aspirin or blood thinners like Coumadin, Eliquis. Also cod liver oil or any kind of those natural. Vitamin E is another one. Vitamin D is okay. There will be a pre-op checklist or pre-procedure checklist that you will be able to utilize in order to guide you into whether people are candidates or not. Okay. So this is the vacutainer. It goes into this just like if you were doing a regular blood draw. So it's nice and tight. You would normally not leave a person on the tourniquet that long. So we're going to just inject here. You doing okay?
Go for it.
And then you see there's a little flashback. So you can see here that the blood is going into the way up to the top. There's some instructions on the Juventix that says to, depending on how many shoulders you're gonna do or joints.
Mm-hmm.
The important thing here is to make sure you're inverting this twice.
Okay.
Okay, and then same thing with this one. We're just gonna draw it up and then invert it twice. Because if you don't do that piece, the anticoagulant gel in there will not get in between where it needs to separate the platelets from the red blood cells. It's coming.
I'm gonna pop this back.
Go ahead. Okay. It says twice, but
Yeah.
I feel like turn our machine on in the back here. There's a turn on button. Open up the machine. There's a button to open that up. You want to make sure you get them right across from each other.
Counterweight, yeah.
Counterweight. And if you're just using one vial, you can use an empty vial of a another type of vacutainer vial, and then you just hit start. It's already set to 3,500.
Close the top of it.
What? Yeah, and then 8 minutes. So that will automatically be pre-set up for you, so you don't have to think about it. So we'll give that 8 minutes to prep and spin and separate. Procedure. So here you see that it's got a nice separation. The gel's in the middle. This is the platelet poor, and this is a platelet rich down here. So we're gonna go ahead and grab that. Might want to wear some glasses. Where are your glasses at? Do you have those little?
They're still in Claremont, I think.
Oh, okay. We'll just.
Sunglasses.
You know, because it splashes in your eye, the blood.
Mm.
Just for protection for yourself.
You can just fill that one up.
Yeah. So we're just going to use this one syringe since we're just doing a, so just be very gentle to grab this because you don't want to disrupt it. Now I find that if you push up against the vial, and Dr. Taylor showed me this, you get stability of the needle, the spinal needle here. So I'm going into the bottom part of the plasma and I'm pushing on the vial to stabilize the needle, and then I'm just gently pulling up on it. And what's really nice is you don't have to worry about the red blood cells. So I'm just getting enough. For a subacromial, you probably need about 3 to 4 mLs depending. So that's good right there. We got about 3. That looks good?
Yeah.
Yeah. A little bit more. There we go. And it's convenient to have a little, even like a little styrofoam thing where you can hold this, because you're just kind of juggling all these things at once, but you're just careful. And that'll be dispensed of. And then for the subacromial injection, I'm going to use a 22 gauge 2-inch needle.